Hi there, my name is Bridget Mackay. I am an attorney. I practice in Petaluma, California, in the area of wills, trust, estate planning, trust, administration, and probates. And my video blog today is answering the question about a healthcare directive. And I had a client call me recently who was the named agent on their mother's healthcare directive and wanted to know, I'm an agent and I need to act, what are my first steps? And it's not often, if you're an agent for a healthcare directive, it's a very big job when you are actually needed to act. In this situation, it was not a end-of-life decision type of healthcare agency that she needed to provide. It was more her mother was had lost capacity because of Alzheimer's, and so she needed to step in and take her to doctor's appointments and be there at the appointment with the doctor and communicate what was going on with her mother and pretty much act as her mother's advocate. So in that situation, what do you do first? Well, the first step is you've got to provide all of that person's caregivers a copy of the healthcare directive, and that goes to in-home caregivers, doctors, supplemental caregivers. So maybe the person's getting acupuncture, maybe they're getting psychiatric help, maybe they're getting massage. I mean, whenever someone deals with this person on a health level, that person should have your healthcare directive where it shows that you're the agent for the mother. That's the first thing. Also, be really clear what the healthcare directive says, and sometimes folks will have additional paperwork on a healthcare directive that the principal will, like POLST, which is a physician's order of life-sustaining treatment, where they have written down what their wishes are in terms of end-of-life decisions, or a document called 5 Wishes, where they talk about how they see being treated if they were no longer able to interact with the healthcare industry. And you follow those, even though they may conflict with your own feelings about how things should be done. And that's very important, because the reason people make healthcare directives is so that their wishes are followed, their religious beliefs are followed, that everything that they want to see happen in their life in terms of their care when they can no longer take care of themselves be done in the way they want to, not the way their agent thinks it should be done. So those are sort of your first step and your second step, and some guidelines to live by when you become an acting agent in someone's healthcare directive.